The broadcast is now starting. All attendees are in listen-only mode.
Well, thank you for joining Obamacare Made Easy for Employers. If you're one of the many small employers trying to figure out what the best thing to do is for your employees, and if you're currently providing a group plan, you have come to the right place to get the information that you need. Now, my name is Greg Downing, and I have spent the last year and a half trying to figure out the simplest, easiest, most cost-effective way to offer benefits to employees under the Affordable Health Care Act, or also known as Obamacare. Now, one of the problems that I face is that all the information that I get about the Affordable Care Act from the media is very biased, it's very political, and it's filled with half-truths. So this does not help me figure out what to do. So I have had to go to numerous other places and spend lots of money. I not only want to count how many hours I've put into this, at least 1,500. So what I'm going to try to do is in 15 minutes tell you what no one else will tell you, especially your group health insurance agent has not told you, about the simplest, easiest, most cost-effective way to offer benefits to your employees under Obamacare. Now, most Americans get their health insurance through their employer. That's the way it's been for a long time. So most people believe that the employer-sponsored group health insurance program is the best option. It's a lot better than health insurance, individual health insurance plans. At the end of this presentation, most of those folks and yourself will probably change your mind because of Obamacare. Now, we all know that health insurance is extremely expensive and continues to increase every year. And because of that, 60% of small employers don't even offer health insurance anymore. And every year we have fewer and fewer folks that are able to offer health insurance, which results in the fact we have so many people that don't have health insurance because it's not provided from their employer. They have a challenge figuring out how to get it in the individual market. They may have pre-existing conditions, and again, it's just so expensive. People are not going to make another house payment to get health insurance, and so that's why we have 1 in 4 Americans that don't have health insurance, roughly. This bill is a monstrosity. It's over 2,000 pages long. You add another 20,000 pages of regulations and rules. Leaves us all scratching our head, and quite frankly, a lot of us are in denial. Half the people think the law's been stopped. So it's just a tremendous amount of misinformation and lack of information about the Affordable Care Act. So there's obviously no way that I can go through all of the information, nor do I want to. I'm going to talk about one key piece, and this is the key piece that will change forever how small businesses provide benefits to their employees, and it's the state exchanges. Now, this is a very simple concept. In the bill, each state was supposed to set up their own insurance exchange, and this is not a new concept. You can buy airline tickets like this, hotel reservations, even buy health insurance like this. The difference is, in the exchange, the government would have certain type policies, and insurance companies would put them in there, and individuals pick the plan that they want. The key to this is the government will provide massive subsidies to individuals that buy health insurance through the exchange. Now, they've had some stumbles along the way. You'll see the word over here, marketplace. Well, one of the problems was exchange doesn't translate to anything in Spanish. We have millions of American citizens that their primary language is Spanish, and they're going to be available for the subsidies. So they thought, well, probably it would be a good idea if they understood it and where to go and what it was. So they've changed the name to Health Insurance Marketplace. They're the same thing. health insurance marketplace is just what the government's calling them now. It's a little more friendly and a little bit more descriptive. Now, how does this work and who qualifies for this? Well, individuals that don't have access to affordable health insurance, which means an employer-sponsored plan, if their spouse doesn't have access to affordable health care through their employer if they work, then that's the first step for them to be able to get subsidies. The second step or process is about income. So as long as their household income is between 100% of the poverty level and 400% of the poverty level, they can qualify for subsidies. Now, if you're like me, I have no clue what that means. Now I do. Here's a chart. It shows you the 2013 Federal Poverty Line Guidelines. And as you can see, that, look at this highlight here. So if I'm a household of one, I can make up to $45,000 to almost $46,000 and still qualify for subsidies. And look down here, if I'm a household of four, shebang, I can make $94,200 and still qualify for subsidies. And as you can see, not that I'd want this many, but if you have five, you can make up to 110. These are not poor people. This is middle America. Think about your employee base. Think about how many of them would fall in here, and that's something that's important for you to think about. Okay, all these little things are fun, but sometimes they don't work like I'd like them to. Okay, so how do the subsidies work? When I think of subsidies, I think of you're going to give me $400 and I'm going to go do this. In this case, this is a capitation of my responsibility to pay for health insurance. For instance, I only have, if I'm at 100% of the poverty level, I would only have to pay 2% of my income to buy health insurance. And if I'm at 400% of the poverty level, I would only have to pay 9.5% of my total household income to buy health insurance. So the government, in their wisdom, believes that affordable means 9.5%. The more you make, it goes up the scale. For instance, let's say that I make $29,000 a year. I have a wife and a kid. I'm at 150% of the poverty level. So at 150% of the poverty level, I would only have to pay 4% of my income to buy health insurance for everybody in the family. And the math on that works out to be about $96 a month. So for $96 a month, I can cover my whole family. Shebang, that's what I'm talking about. Now, and if that's too expensive, there's a plan that's the bronze plan, which is the bottom level plan. I might even be able to get that one for free. So when you look at the numbers and you start playing with it, it's quite surprising. Now, we estimate that close to 70% of the population makes less than 400% of the poverty level. I know this is a lot of percentage and numbers, and I'm going through this fast, but this is just to get a point. If you can get a lot more details, subscribe to some of our free reports that we have, and it breaks it all down, and you can go through it with a fine-tooth comb, and you go, oh, there you go. But this is an overview. Matter of fact, in Texas, the average household income is $48,000. So a lot of individuals will qualify for subsidies as long as their employer doesn't provide group health insurance. And remember, if you have less than 50 full-time employees, you're not required to provide health insurance. Period. There's no penalty, there's no fine, nothing. So what I want to give you an example is, we've always been told that if you offer health benefits, you're going to recruit, retain better quality individuals, and it's going to give you a leg up on the competition. And that's really been fairly accurate pre-Obama. So let's just look at this example. So let's say that this is me, and I've got a wife and 2 kids, and I'm looking for a job. Employer A has offered me a job with a salary of $55,000. He has group health insurance, which is important to me because my wife, I believe, is pregnant, and then I got a kid. He's got some issues, medical things that we want to make sure that are taken care of. So health insurance is important. So this employer over here will contribute $5,400 a year towards my health insurance cost. So that puts my compensation at $60,400. And the good thing about employer A is my insurance cost will be paid pre-tax when I pay for my family cost. I have guaranteed coverage through the employer. I don't have to worry about, not getting approved, and they will cover maternity, and it has a comfort level for me. It's helpful. Over here with employer B, who I really would love to work for, has offered me more in salary, which is the exact same total compensation. It's just he doesn't have health insurance. But he's got a cool office, and they're doing what I want to do, but there's no health insurance. So I have to go think about this. So when I go to think about this, I want to go to employer B. I mean, that's who I want to work for, so I'm going to start there. So this is my taxable income, so I have to pay taxes on all that. There is no employer contribution because there's no health insurance. And this number right here, which is excessive, you might say, but yes, that's the average cost for family coverage throughout the country in 2012. That's just how much it costs. That's an average. So we're going to use that number, and we'll use that same number on both sides. So we're comparing apples to apples. In this situation, I will have to pay that amount in taxes. I'm at the 15% tax bracket. So the thing to look at that I'm looking here is what is my net take home. So it's $36,784 is my net take home if I can get insurance. And I have to pay for that myself. So, okay, so let me go back over to employer B. Now you'll notice that the taxable income is a lot less, and the reason that is my salary is $5,400 less because he's putting that towards health benefits, plus all of the contributions I make towards my health insurance premiums are pre-tax. So that definitely knocks down my tax load, and you'll see that I have more take-home pay by about $2,200 working for employer A than I would working for employer B. And being that all the things that are important to me, probably I'm going to go to work for employer A because health conditions are an issue. There's a little more security there for me. So in this instance, what we've always been told is true. I'll probably go to work for employer A because he does offer benefits, and he'll probably win me over. All right. Now let's go to post. Go to normal drawing mode here. I'm learning still. So if we go to after Obamacare, beginning in 2014, everything changes completely. And let me show you why. So employer A, we already know what he's doing. He's got it happening other than his hairdo. But employer B, look what's happened over here. The federal, now if I go to work for employer B, I can qualify for the federal subsidies to pay for insurance. And not only that, beginning in 2014, all pre-existing conditions are covered. And I can get maternity coverage. So I'm going, well, hey, this looks a whole lot more interesting than it did prior to not having health insurance. So if we go to the next page, and I go home and I think about this, I already know what employer A is offered. So how does it dress up over here with employer B? Well, check this out. We've already done that, but look at this thing right here. That is, let me go back. I hate that when I do that. Let's go back. All right, look. This is the government's contribution to my health care. And that is a big number. How much is that? $9,580. Wow. That's a lot of money. And my insurance cost is only $4,976. Not that that's anything to sneeze about, but it's a whole lot better than this scenario over here. And as you can see, I'm getting, well, that's kind of covered up. I apologize for that. But the bottom line is my take-home pay is $7,400 more a month with employer B, who doesn't even provide health insurance. Employer A over here, old school, all that thing we've been told doesn't come true anymore because of Obamacare. So I'm going to jump to employer B quick as I can. Now here's another little thing that you need to think about. If my health insurance cap is always going to be, and let me fill this in, since I'm at this level, $60,000, that puts me, with a family of 4, I'm at about 250% of the poverty level. So I only have to pay a little bit more than 8% of my total income towards health insurance, and the government picks up the rest. So think about this. What if next year that's not $14,000, that's $22,000? Guess how much my cost is as an individual? It's the same cost. It's 8% of my adjusted modified income, and the government picks up the rest. Over here, it's not the same scenario because me and the employer have to figure out how we're going to pay for that extra income. So, very important to remember that information. Let me just get out of this right quick. Erase all. Okay, let's go to the next page. So, with all the new changes, I think, I'm just telling people, hey, we got to rethink what we think an employee benefit is, because in this case, the employee benefit's not real beneficial with health insurance. Now, here's some questions that I'd like to ask you. Did you know that employees can pay for individual health insurance pre-tax through payroll, which saves them lots of money and you money as an employer? Did you know that you can give your employees a pre-tax health care allowance and let them pay for their own health insurance, or they can use it for any qualified health care event, dental, vision, co-pays, deductibles, prescription drugs? Did you know you could do that? You can. No one just seems to tell you about that. And if the government is going to pay and subsidize for close to 70% of the population and of your employees possibly, why not let them do it? Do you think you can compete with what they're going to be able to do? The answer is no. There is no way I can compete with that. So I'm just going to let them take care of 70% of my employees, if you will. So with all that being said, we believe the simplest way to do all this is to forget about providing group health insurance, but don't stop providing group benefits. You may have heard of the term private exchanges, defined benefit contributions. This is where we're headed. This is an example of a private exchange that we've set up for our company, Funny Healthcare. So our employees can simply go. They have a toll-free number they can call. It's open 12 hours a day. They can talk to licensed insurance agents, say perhaps that they're interested in health insurance, or they want to know if they qualify for the subsidies. Well, we just send them there. They click on this button or they call the number, and they're able to speak with a licensed insurance counselor that helps them decide what's best for them. Maybe some of your employees want dental, vision coverage. They can select that as well. So in this whole process, you can decide, hey, we're going to give everybody $200 a month in a pre-tax allowance, or you may just say, I don't want to mess with it. We'll bump up everybody's payroll a couple of $100 a month, and then you're on your own and you do what you want. But this way, you're still providing benefits for the employees. They're able to select and do what they want. And they can access both the subsidized insurance programs from the government, or if they don't qualify, they can get the help getting the insurance plans they need that aren't subsidized but meet the qualifications, plus anything else that they might want to buy. Now, clearly, everybody's a little bit different, and you're not going to be able to please everybody, but instead of just saying, hey, here's your group plan, take it or leave it, and we've blocked you from the subsidies, thank you very much, why not just let every individual select what they need? If you have some employees that could care less, well, that's their choice. You're not responsible for them. For quite frankly, I'm tired of being responsible for all my employees' health care needs. This is a way that you can give them the vehicle to get what they need, and if they choose not to do anything and they just want to pay the tax, that's fine too. You saved yourself some money and some frustration. Now, let's say that you do want to provide some type of group benefit for your employees. Well, look at things like telemedicine. Telemedicine is simply the ability to get on your phone and you can talk to a doctor. You can have a complete, comprehensive physical, well, not a physical, but a complete comprehensive exam over the phone by questions and answering. It's a consultation, and they can even prescribe prescription medication. That doesn't cost very much. We also recommend getting some of the Wellcard discount programs where people can save up to 50% on dental, vision, prescription drugs. You can combine that together, and for less than $20 a month, you can have that service for all your employees and anybody that lives with them. That's a lot better than trying to pay for health insurance. Let the health insurance be the responsibility of the government and the employee, and that's what they do, and you give them low cost, high return benefits, and it's so much easier. Now, very quick overview. I'm wrapping this up right now, but please, if you have questions, call me. Sign up for some of our free programs. Get some more information about this. Email me, whatever you do. Oh, whoops. This is a bogus number on the expedition there. Don't call that. It'll be disconnected. You need to use this number here. Sorry, I thought we had changed that, but we didn't. So give me a call if I can be of service. If you have questions, if someone else has given you this information or this, visit with them. We're just trying to make this as easy as possible, and that's what we're here for. So have a great day, and I look forward to speaking to you in the future.